Hi, I'm John Howard. I'm a licensed acupuncturist in Germantown, Maryland, and welcome to my series of videos titled Clinical Pearls. Today, I'll be discussing and then teaching you a technique to determine if your patient's pain is coming from their dental fillings, body, ear piercings, or their jewelry, or a combination of one or all three. This is a technique I learned last year when I was in Lyon, France, from Dr. Raphael Noget. It's a very easy and effective way to determine if this is their true cause and the root of their pain. Before we begin this technique, I'm going to go over some of the supplies you're going to need and a little bit of information about what each one of the supplies does before we get right into the protocol. So let's begin. The first supply you're going to need is a voltmeter. You can pick these up at any local hardware supply store or even at Walmart, where I purchased mine. They cost anywhere between $15 to $20. Next is a dental relationship chart. You can find these online, where I got mine. They run anywhere from about $5 to $10. You're going to need some alcohol, cotton balls, or some alcohol swabs. And last, you're going to need Orajel or Anbesol and some Q-tips. I'll talk a little bit later about why you're going to need these two supplies, but I'll discuss that later as we're doing the technique and protocol. So let's talk about the voltmeter. A voltmeter is a machine or device that measures electrical current. You'll find that most people who use these are electricians. They'll work in a house or a building and they'll see that the outlet they're working in, if it has electric running through it. We're using our voltmeter for the same reason. We're going to test and measure millivolts. But our outlet is the body. Let's say, for instance, that you have pain somewhere in your body. Let's take your knee. How does your brain know that your knee is in pain? There's a cell-to-cell communication system called action potential. Action potential is triggered when the cells reach a threshold level of anywhere, depending on the cell, from 35 millivolts all the way up to 80 millivolts. When that happens, it sends a message via the nervous system from that part of the body to the brain that says, hey, there's pain here. And the millivolt machine that we have is going to test for that today. We're going to determine if your pain is measurable with a millivolt machine. Now, like I said just a second ago, action potential is triggered once it reaches anywhere from 35 to 80 millivolts. What we're testing for is anything above 130 millivolts. If that's the case, there's a good chance that we know where this pain is coming from. Now, action potential is a very short acting event. It's really quick, just a few microseconds. What we're looking for with our voltmeter is a sustained level of anything above 130 millivolts. The dental relationship chart, as you see here, is used to determine what part of the body that each specific tooth corresponds to. Let's take, for instance, your premolar or your first bicuspid. One of the areas of the body that is regulated by that tooth is the big toe. I'll show you later on in the technique what I mean by this. One of my patients was experiencing pain in her big toe on her left foot. So by using the dental chart conversion table, I was able to determine what tooth to go for and to see if there was a problem with that tooth. See if the dental filling was causing any disturbance in the electrical field. And you'll see what I found. The first thing you're going to do is clean the voltmeter probes. These right here. You're going to take alcohol and cotton or an alcohol swab and just clean the tips of these probes. Then what we're going to do is you're going to take the voltmeter and turn it on. Turn it up to where it can read up to 2,000 millivolts. And the reason that is because most millivolt machines go 200, 2,000. If you put it on 200 and the reading is over 200 millivolts, it will register a 1 or a 0 and you won't know the true reading. And you'll see later on in the demonstration a patient who is reading above 200 millivolts, and you'll see what it looks like. Remember, we want to find the exact reading, which is very important. So now we cleaned our millivolt machine, and now we're ready to begin. So we're going to take each one of the probes, a negative and positive, and we're going to place it in your patient's mouth like this. Each probe should be touching one filling. And we're going to go to each one of your patient's filling and take a reading. If you do not obtain that 130 millivolt threshold, the next thing we're going to do is we're going to look at your patients to see if they're wearing any jewelry or have any ear or body piercings. And then we're going to test each one of the fillings to corresponding pieces of jewelry or body piercings on their body. As you see here, I'm testing the probe on the premolar or the first bicuspid in my patient's ring. As you can see, the reading is above 130. It's 135 millivolts. This tooth, the first premolar or the bicuspid, corresponds to the big toe. This patient has big toe pain in her left foot. To treat her, the simple thing to do is just take the ring off and have her walk and see if the pain goes away. For this patient, that's exactly what I did, and with 5 or 10 steps after taking that ring off, as she was walking around my clinic, her pain went away. We're going to test your patient's fillings with their body jewelry. As you can see here, I'm touching the belly button ring of this one patient, and you can see it's above 130 millivolts. When I touched the patient's filling and then went to one of her pieces of jewelry around her neck, her reading went off the chart. As you can see here, it's 198. That was a picture taken before it went over 200. We don't know the exact reading because I didn't have a voltmeter with me that read over 200 millivolts. This patient was nice enough to let me come to her house and try this on her. The voltmeter that I was using was her husband's, who's an electrician, who couldn't believe that she was running millivolts through her entire body. Now, with prolonged current running through your body, you will notice that your body starts to break down. The brain is getting confused, mixed signals saying there's something going on. So what's going on there is it's throwing the whole entire electrical system off, which could, in return, be causing pain in those specific areas. So I test a millivolt machine to her filling, and then I test it to her necklace. Then what I did is I took the necklace off the patient, and I held it with the probe. I kept one of the probes in her mouth, and the reading was 0. The reason why this is, for this to work, the jewelry, the body piercing, has to be connected to the patient. With the dental filling and the body jewelry or the body piercing, you have most likely 2 different metals. With the saliva in the mouth, you have a conductant. You basically have a battery effect. Your patient's pain is being caused by the galvanic or the direct current that's running through from the 2 different metals and their saliva acting as a conductant. Their pain is coming from their jewelry. Earlier I mentioned Orajel or Anbesol. I'm going to explain to you how to use these. Let's say that you test your patient. They don't have jewelry, they don't have any body piercings, but they have pain. Let's take, for instance, the big toe. They have pain in their left big toe. Now we know one of the teeth we want to test is the bicuspid or the premolar. If they have a filling there, that's where you want to put one probe. And then you want to take the other probe and touch other fillings. If you get a high reading with this bicuspid or premolar, what you can do to help with that pain is try a little bit of Orajel or Anbesol with a Q-tip, or your patient, if they can do it at home, they can just put it on with their finger. Now, make sure that as a licensed acupuncturist, you can prescribe over-the-counter pain medication as a local anesthetic like this. I would check with your state laws first, but be very careful. This will work temporary. Their pain will go away temporary. These patients need to see somebody called a biological dentist. There's an interaction most likely going on with the fillings in their mouth that's causing this galvanic or direct current that's making them have the battery effect. And it's a good possibility that that direct current or galvanic current is causing their pain, especially if you have the dental relationship chart. and you know where their pain is coming from, let's say the big toe, and you're seeing a high volt or millivolt reading in the first premolar or the bicuspid, you're going to know that there's definitely something going on, and you're going to want to get them checked out by a biological dentist, somebody who specializes in this type of filling problems. One other thing I want to say is if you're getting a voltmeter reading and you see there's a negative or a line in front of your number, that's easy to correct. All you do is switch up the probes. If you have the red probe in the mouth and the black probe on, let's say, a piece of jewelry, just take the red probe, put it on the piece of jewelry, and put the black probe, the negative, in the patient's mouth on the filling. And you'll see that that negative sign will go away. It's easily corrected. So now you understand this technique and how the battery effector works. Let's say, for instance, you do not have any of this equipment, but you still want to determine if your patient's pain is being caused by, let's just say, their dental fillings. Here's an easy and quick way to figure this one out. If they just went to the dentist and they had, let's say, work done on their premolar or their bicuspid, and they're having pain in their big toe, what I'd have my patient do is take their index finger, and if it's on the left side, push down or push up on that tooth and have them walk around to see if their pain goes away. If that's the case, it's most likely a cause between interaction between the two different metals in the mouth, and then they should go back and see their dentist. But again, make sure that they see a biological dentist. They're the ones who will accurately and address this problem. What you need to do first, before you get into a lot of testing, make sure that their jewelry or the body piercings are not causing their pain. And my one patient who had the body piercing in her belly button and the necklace, all her pain was in her back. And it's very interesting because right behind the belly button is the lower back. And when I treat the lower back, one of the techniques I can do is mirroring the body, is treat the upper clavicle, the kidney points too. And that's where the chain was touching her skin. So here's an easy and a quick way to determine where your patient's pain is coming from. And it could be simply as just taking off their jewelry or their body piercings. Now that might be a little easier said than done, but tell your patient, just try it. Just try it for a few days or a week and tell me, does your pain go away? I learned this technique from Dr. Raphael Noguet in Lyon, France. In October of 2012, Dr. Noguet would be coming to Johns Hopkins in Maryland to teach his 3-day auricular course. You can learn more techniques like this and learn from a true living master. So I hope you enjoyed my clinical pearl on determining if your patient's dental fillings, body, ear piercing, or jewelry is causing their pain. I hope you enjoy this, and the next time you have a patient, give this a try, and within a few minutes, you'll be able to tell if this is the root and the source of their pain. Thank you for watching.